Good afternoon and welcome to today's session, Accountability Infrastructure, Uncovering the Keys to a Successful Patient Engagement Strategy. My name is Christy Grau and I'm in the Value Management Lead for the Government and Pediatric Service Lines for GetWellNetwork. During today's session, our presenter from GetWellNetwork will share his experience on accountability and infrastructure. This topic will help map out all of the components that need to be in place to ensure that deploying the GetWell system at your facility is successful, but also the ongoing day-to-day and month-to-month attention needed to support the staff and workflow practices to ensure that your facilities do not lose momentum and excitement in using the technology to support patient engagement. It is my pleasure to begin this afternoon's presentation by introducing our presenter, Carl Murnau, Senior Director, Government Client Services. Carl received his bachelor's degree in science focused on information technology management from Trident University International and is currently working on his MBA in healthcare administration. He is a retired Army combat veteran, serving 15 months supporting Operation Iraqi Freedom as a paratrooper medic in the 4th Brigade, 25th Infantry Airborne Division. That was a mouthful.
She's Navy.
I know. It's like, okay. He has over 20 years of healthcare experience from direct care to operational management of healthcare facilities. He has worked for GetWellNetwork for 7 years. In his current role, he has operational oversight of the Government Client Services team and primarily focuses on bringing value of the GetWell solutions to our clients. After hearing from our presenter, we will open the floor to you to ask questions. Before we get started, and you've heard this before, I need to share a disclosure statement with you from the Maryland Nurses Association. The Maryland Nurses Association is an accredited approver of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. If you wish to receive credit for attending this activity, you must complete the session survey found on your conference mobile app. In the survey, it is important that you check the box indicating that you would like to receive credit and enter your full name and email address in the space provided. Your certificate will be sent to that address. In compliance with the continuing education activity credit conflict of interest disclosure requirements, we'd like to announce that the presenter of this session has no commercial association that would create a conflict of interest. Carl Murnau will kick off our session today. Welcome, Carl.
All right, good afternoon, everybody. So as you all know, my name is Carl. I'm the Senior Client Services Director with GetWellNetwork. Like Christy said, I've been with the company for 7 years. I started off my journey with GetWellNetwork as a client service manager for one of our Vision 8 facilities. So Megan in the office, she always gives me a hard time because I always reference Vision 8 because I started in Vision 8, which is, if you're not familiar with the VA, they're the healthcare system in the state of Florida. They have the largest retiree population in the country and probably have the largest census within the VA. And whenever you look on CNN, it's always a site from Vision 8 that happens to be on there. So, yeah. But that's why we're here, right? We're here to change that. We're here to change that perception. So let's talk about accountability and infrastructure and uncovering the keys to successful patient engagement strategy. This is something that I get asked all the time when I'm on site meeting with clients is how do we hardwire this into the care practice? All of this great tools that you're going to be giving us, these pathways that you're going to be providing our facilities, how do we get our staff to use this? And how are we going to measure success moving forward? So what I'm going to do today, I really want you to take away 4 key things, and it's on the agenda here. I want you to look at defining an accountability culture. So we're going to go into a little bit of theory around what that means to have an accountable culture within your facility. Developing a culture for framework of accountability and patient engagement strategies and how they're going to work together, and then a successful client accountability strategy. At the end, we're going to share some best practices because we've been in the business now for 20 years doing this, and I've been in the VA business, in the VA government world for 7 years. We're going to share with you best practices that we've seen from the 51 VA medical centers that have gone live with our solution. So for some of our newer partners that are in the room, a lot of this stuff you'll be able to take away and take back to your organizations to put into practice. So before I get kicked off, I just want to raise a hand. Who in the room actually works for the VA? Go ahead and raise your hand. So what I want to do, as a combat veteran, I am service connected, so I do get my care at the VA, and so I just want to express my personal gratitude and thanks for choosing to work for the VA. Thank you for taking care of our nation's veterans. You know, they definitely earned, I know y'all hear entitlement, but they definitely earned what you guys are providing to them. You could work anywhere, but you chose to work for the VA, and I just want to thank you for that, so thank you. Because I know you don't hear it enough. So let's look at, I'm just going to look at my notes here. Let's look at professional practice. So the professional practice model of accountability is where the individual clinician and patients participate in shared decision-making, and clinicians are actually held accountable to professional colleagues and to patients, as stated in the National Institute of Health in 1996, as you see on the quote on the screen there. Accountability entails the procedures, processes by which one part justifies and takes responsibility for its actions. So that is really our goal when we're talking about creating a culture of accountability within our organization. So we can also argue that no single model of accountability is appropriate in healthcare today. So the purpose of a stratified model of accountability is in which each serves a different purpose in the landscape between patients, provider, managed care, government, and professional association. Despite variations in approaches to accountability, an accountability regime will always be based on the three elements that you see up on the screen. Clear definition of desired goals and objectives, the ability to actually measure and monitor that goal achievement moving forward, and then taking action for non-satisfactory performance. That's probably the one piece that facilities, in my experience, they really struggle with. You know, how do we hold our folks accountable if we're not seeing the utilization, you know, and the expectation of accountability within the organization? So looking at the HRO model, and I know the VA is beginning their journey. They've identified 18 facilities across the country. Some of them are represented here in the room, around taking the journey that the Joint Commission has set forward around becoming a high reliability organization. So what are we talking about? In an HRO, leaders are not identified by position or rank. They exist at all levels within all groups within the organization. And the HRO framework requires that all formal and informal leaders are committed to achieving a safe, reliable, and effective operational excellence. Leaders should take ownership for the setting and the climate and focusing the work. So whenever you're leveraging our tool and whenever you're going live with our tool, whether it be a new implementation or if we're coming to do an optimization, you're going to hear me talk about this all throughout my presentation today. It has to start at the top. Leadership have to be engaged, and they have to set the goals and the priorities for where you want to leverage this tool moving forward. So establishing that culture of accountability, see it, own it, solve it, and do it. So where people are demonstrating high levels of ownership, they're going to think and act in a manner necessary to achieve those organizational results. The defining characteristics of this kind of culture is that people voluntarily assume their own accountability. Rather than having accountability forced on them, they're going to enthusiastically take it upon themselves. One thing, you know, from my 21 years that I served in the military, you hear the term discipline. Discipline is always doing the right thing when nobody is looking. So really, when you're developing an accountability culture within your organization, you're going to want your staff to do the right thing, you know, when nobody is watching them. So that's really the ultimate goal behind creating that culture of accountability. So people at every level in the organization, they need to be personally committed to achieving that key result targeted by the team or the organization, and they never have to wait to be asked for a progress report or a follow-up plan. They're just going to take it upon themselves and they're going to do it. Instead, they're going to report proactively, follow up constantly, diligently measuring their own progress because they have internalized their commitment to achieving the results that we had set forth within our value plan for our organization. So when you're looking at developing a culture of accountability, looking at the pyramid that you see up on the screen, leadership at the bottom, the reason it's at the bottom is because it's going to carry all the weight when it comes to creating this culture of accountability. They're going to set the common purpose. They're going to establish those clear and open lines of communication within your organization. They're going to establish training. They're going to write the policies and the procedures. And then at the end of the day, they truly are going to have ownership of our journey. When you hear me come on site, and I conducted a couple of clinical practice design sessions recently with some of our new logos, one of the things that I always stress is ownership. I mean, we're going to provide you with the tools to be successful, to make the change that you expect to get from our solution. But at the end of the day, your facility has to own this. You know, we can't own it for you. We're going to be the consultants. We're going to help guide you along your journey, but your facility has to own this journey. You have to do everything that's listed here to make yourselves accountable so you see the actual results that you expect to see from leveraging our solution. Setting a common purpose and clear lines of accountability. We're going to talk about common purpose and clear and open communication. When I talk about common purpose, I'm talking about having clear and set goals for the desired outcome that is shared across your organization. Whenever we come on site and we bring a new logo live with GetWellNetwork, we establish what's called a value plan. Hopefully, how many of you all have heard the term value plan? Hopefully everybody in here that is a client of ours have heard it. So we have to have that value plan in place. What that value plan is going to tell us is you're going to tell us what are your strategic initiatives that you want to leverage the GetWellNetwork solution in order to achieve performance improvement. New clients, I always tell them, pick 2 to 3 areas. Let's start small, and let's build off of that throughout our relationship. Once you establish that value plan, we're going to match technology based off of that, those focus areas, and then we're all both going to decide on what is the expected outcome that we expect to see. An example would be if falls prevention is one of your priorities that you want to set for your organization, we're going to tell you, well, using our technology, best practices, we have education around preventing falls, and we also have a falls prevention pathway. Let's get those live. Let's get your staff trained. Another piece that you need to remember is we're not only training staff, we have to also train that patient in the bed, especially amongst the VA, because a lot of these VAs were installed in their community living centers, which is their long-term care facilities. That's the veteran's home. That's where they live. So their television is no longer just a TV. Now they have this smart device that's demanding stuff of them. So we want to make sure that we don't forget that the veteran needs to be trained as well. Clear and open communication, having that culture of zero blame for all staff to be empowered. Once we have that value plan established, it should not just sit at the executive level within your organization. You want to make sure that that value plan is shared with everybody within your organization. So the end user, those clinicians that are on the floor, in the grind every day, taking care of patients, they should know why they're being asked to use, the GetWellNetwork solution at the bedside. Because one of the struggles that I see is, nurses, they have a lot on their plate. They're task-oriented, they're doing all kinds of, work, trying to manage multiple patients, and now we're putting another piece to the pie. What is in it for them? And so we want to make sure that they understand that there's a value plan in place, that leadership has endorsed this, and that this is what's expected of them, and this is what they're going to get out of it. At the end of the day, using our solution, we're going to give time back to that nurse. We're going to allow them to be able to operate at a higher level because we're going to be able to take some of those non-clinical tasks off of their hands through some of our solutions that we offer around, typical things that the veterans or the patients on the call bell for. Maybe they need their room cleaned. Maybe they might have something that's non-clinically related that they have a question for. We can take our solution and take all of that off of nursing's hands so we can give them some time back in their day to focus on clinical tasks and not focus on the non-clinical stuff. Training and policy and procedure. For training doesn't just stop at go live. Once we conduct that initial training, you have to have some type of sustainment training plan in place after go live. So we're going to go over some best practice recommendations at the end, but training, you should have some type of annual competencies in place. You need to have some type of training for your new employees that get brought on board. Because GetWellNetwork, we're going to come in, we're going to conduct the training for go live, but then again, we need to have something some type of sustainment training program in place moving forward, once you are live with the system. And then policies and procedures, you have to have some type of SOP and some type of policy in place that supports patient engagement as your digital health strategy for your organization. And so we can assist you with writing medical center memorandums that are signed off by your director that will outline, patient engagement as a digital health strategy for your, and a digital health education delivery tool for your facility to help set those expectations for your staff. And also, VisionAid actually took this one step further, and they put this as part of their network director's performance plan. And for the non-VA folks in the room, a network director is kind of like your health systems director. So you have multiple hospitals that fall up underneath the VISN. So this actually became part of the VISN level director's performance plan, which filters down to the individual facility directors. And now there's accountability. You can see there's an accountability structure built there to hold those individual facility directors accountable for the use of the patient engagement solution at their facilities. So it helps drive that interest. So let's look at how technology can actually support the professional practice and accountability. So let's look at facility collaboration. That's huge, and that's really why we're here for the last 2 days. We're not only presenting best practices that we're seeing across our client community. We want you to develop relationships amongst your peers, so that way when you leave GetConnected and you go home, you now have some folks that have been GetWellNetwork clients for years. You have some folks that have come on board as new clients. You now have those contacts that you can collaborate on a regular basis, share best practices. That's why we're here. That's why we're trying to share best practices, so that we know what works, we know what's going to get you the outcome, so let's share that across our client community. So that way we're not reinventing the wheel every time we install a new software solution at a particular client. Less manual entry into the veteran record. This was huge. So Melissa, who is our integration project manager, who was here earlier today, if you were in an earlier session, it took us 4 years from the time we started our journey with the VA to finally get approval from OINT for us to be able to write back into the patient's electronic health record. And so before that happened, it was a struggle. It was a struggle to Megan's laughing at me. It was a struggle to get any utilization out of GetWellNetwork because there was no in for it. You want me to use this tool, but I still have to go in and I still have to manually enter this education back into the health record. Well, now that you're integrated, and now we're integrated across the entire VA, they can now order education from the health record, and we're going to document that completed education back into the health record. We're not only going to document what they watched, we're going to document who watched it, and then the things that Joint Commission likes to see is, did they comprehend what they watched? So we're going to document who watched it, what they watched, and if they understood what they watched. Spend more time on direct care and veteran care. We talked a little bit about that. We do have software and solutions in place through our service request pathways, through our patient experience pathway, to where we can send messages, real-time notifications to those other services within your facility. One thing that I do notice a lot, that the VA likes to make this a nursing project, and they make nursing own it, but we're multidisciplinary. We touch every single service within your facility, so it should not just be looked at as a nursing project. We have to spread it because we can touch chaplain services, we can touch EMS, we're going to touch FMS, so it's important to make sure that that's spread out. More efficient veteran education and teach back. You were probably in the session earlier, and I'm really excited about what's coming to the revamp on our user experience, on how now we're telling veterans the why. Why is it important for them to complete that education, which is a piece that we were missing before. Instead of a veteran just getting told you've got new education assigned to you, click yes or no to watch it, they're actually going to get a nice little prompt on the side of their screen that's going to tell them why. Why is it important that you need to complete this education? And then effective care coordination and follow-up would be the last piece, that how technology can help support your professional practice and accountability. So let's look at the framework. Let's look at those 4 areas again around common purpose, open communication, training, and policy and procedure. So looking at that arrow up at the top, that's the life cycle of whenever we bring a new client on board to GetWellNetwork, we typically always follow this life cycle. We go through the implementation. That's where the hardware gets installed in your facility. That's where we're going to work with you and do clinical practice design to develop this actual software solution that's going to be shown on the televisions. We go through user acceptance testing, where you're actually going to be able to see what that software looks like before it goes live for your patients to see. Then we're going to conduct go live, which is we turn everything on at once at the facility. We go around, we train the patients, we train the staff again to make sure everything is good to go. And then from there, we're going to do, and this is a new thing that we're starting to do this year, is we're going to be doing an accountability workshop with each of our organizations. And this is where we're going to decide, and we're going to meet with all of the care team within the facility, and we're going to figure out how we're going to hardwire this into care practice within that individual facility. There's no turnkey solution on this. Every facility is different. For the VA folks, you've heard this term, one VA is one VA. That's very true. One VA is one VA. They try to standardize as much as they can, but you've got different socioeconomic backgrounds of your patients. You've got different age groups of your patients. So you can't just have one solution. There has to be a solution that's tailored for each individual facility. We talked about the value plan, aligning technology to achieve those organizational goals, open communication. One piece that we can do with this, where we'd like to partner more, is with your PAOs at your facilities for the VA folks. Because the VA, and unfortunately, the news, you get a lot of negative press. And one thing that my goal for this year is let's start to celebrate those stories. Let's start to celebrate those successes that we're seeing amongst the client community. And so my team, I've tasked them with, let's develop some relationships with the PAOs. If we see a particular outcome happen in a specific focus area on your value plan, let's celebrate that. Let's do a case study behind that. Let's see, because GetWellNetwork will never claim 100% accountability for an outcome, because obviously there's three things that happen. There's people, there's process, and technology. We're just the technology piece, but there's people behind it, and there's a process that you put in place to enable that outcome to happen. But let's do a case study behind that. Let's write up something, maybe publish something, within an internal VA journal that can be shared amongst the client community, but let's celebrate those successes. Let's not just keep the secret, because now you're 51 VAs across the country now. So there's VA, everybody's hungry to know what other folks are doing. So let's share those wins. Training, we talked about it, new employee orientation, obviously that's key. Some best practices I've seen out there is the director, when they come and they meet new employees, they typically will have like a 3 to 5 minute spiel around patient engagement and the use of GetWellNetwork technology. That's really key to setting that stage for those new employees. But then also part of nursing orientation, having that piece too during nursing orientation to talk about, how do they go into CPRS and order the education? How do they use our management console to monitor outcomes, monitor utilization and success moving forward? But then remember, that doesn't just end there. You want to make sure that you have a sustainment training plan in place, do annual competencies, and then also what are you going to do when nurses switch from unit to unit. And then the policy and procedure. That medical center memorandum is if you don't have that at your facility now, get with your client services team and let's get one in place at your facility, because that's going to be your tool that you can use, for accountability within your organizations. Because once it's been signed off by your director that patient engagement is a core strategy for performance improvement, you can use that as leverage, during your annual performance reviews with your employees, to show them that this is important and this is what we need to be doing. Having accountability outcomes, organizational versus clinical. So organizational, obviously our solution on the government side, we're really trying to impact two areas, sale and SHEP. That's how the VA gets graded in their quality and their veterans patient satisfaction outcomes. On the commercial side, we look at CMS, we look at HCAPS, we look at CGCAPS. So they're basically the same thing, just the VA has their kind of own homegrown system that they use. But really at the end of the day, that's what we're trying to do. We're trying to improve the veteran experience, and we're trying to improve the quality of care that's delivered within those VA organizations. You want to be able to decrease readmissions, average length of stay, and then you want to reduce falls. On the clinical side, we're looking at improving clinical efficiency, we're looking at standardizing education delivery, and then we're looking at enhancing collaboration between the care team, the veteran, and the family. This is one piece that some VAs do really well at, is incorporating patient engagement into the daily rounding, into the hourly rounding that's being done by leaders, the multidisciplinary rounding that's being done by your multidisciplinary team that rounds on your patients every day. Having patient engagement is part of that conversation. So again, it stresses that this is important not only to the staff, but to the veteran in the bed. All right, so let's look at some best practices. This is probably what you're all waiting on right now, is what works. So in our 7 years that we've been doing this with the government, with GetWellNetwork, we're going to look at those 4 areas again, but what I'm going to share with you is what those best practices that we've seen work within our VA community. So the first one around leadership engagement, what is the goal behind this? What are we trying to achieve? We're trying to support the vision of patient engagement within your organization. So the 4 best practices: establishing the executive steering committee, and not only establishing that executive steering committee, you want to make sure you have ELC involvement in that, and you want to make sure you have somebody, at the PENTAD level that is involved, within this committee. Because you have to have some type of oversight structure in place to monitor patient engagement moving forward. Ensuring there's a cross-functional leadership involvement. Again, like I mentioned before, don't just have this as a nursing tool or nursing initiative. This is a multidisciplinary facility initiative. So we want to make sure we have multidisciplinary leadership involvement within this committee. So we want to make sure you have CNO involvement, maybe your administrative operations involved in it, associate directors involved in it, chief of staff involved in it. I'm just going to give a shout out to Northern California, who I was with last week. their hospitalist and physician involvement within GetWellNetwork is incredible. I mean, I was just blown away at the level of commitment that their physicians have in making this product, successful within their organization. So they're going to be a really fun group to work with once you go live. Ensuring that all staff members are responsible for making patient engagement operational decisions with the executive champion. That's where this steering committee really comes into play. A best practice that I've seen throughout the community on this, I'm going to reference Vision 8 again, because in Vision 8, they not only established local operational steering committees within the VISN, they have a VISN-level executive steering committee that meets on a monthly basis, and then they actually have those facility operational steering committees report up into the VISN-level steering committee on a monthly basis. They also have IPC report up. It's different at every facility, but they have it report somewhere else within their facility, whether it be veteran experience, whether it be underneath quality council, could be under shared governance. Wherever it works for your facility, there's really no cookie-cutter way to have it there. But as long as the information and the outcomes and the data is being reported, really ultimate goal is you just want it reported to your facility leadership so they can see that they're getting the return on investment out of our product. And then developing the accountability structures for nurse managers. Having that medical center memorandum is going to set that expectation up front, and so it should be part of their performance counseling that they do on a semi-annual basis. So let's look at clinical adoption. The goal behind clinical adoption is you want to be able to integrate patient engagement as the standard of care within your facility. I mentioned this a little bit earlier. Nurses have a lot on their plate. They're trying to manage multiple tasks, multiple things. How are we going to incorporate patient engagement, into that list of things that they're already trying to worry about on a daily basis? The way we're going to do that is we're going to identify super users. Our recommendation is you should have 2 super users per unit per shift on each of the units that have GetWellNetwork installed. Might seem like a lot of folks, but they are going to be your subject matter experts on the use of the patient engagement solutions within your organization. We're going to be there to support you along the way, our client services team, but we can't be there 24/7. So you have to have folks within your facility that are going to own this and be those subject matter experts for the folks, at the other end users on you to be able to go to, and have those discussions with. Develop a plan to orient patients as part of the admission process. I know the folks that are used to working with me, I talk about this all the time. You have to onboard veterans to the GetWellNetwork system upon admission to the hospital, especially in the veteran community, because the veterans, because of their socioeconomic background, for most of them that come into the VA, they don't have computers at home, they don't have smartphones, they're not used to technology. Some of them might be homeless, so you're bringing them into a setting now where they're already uncomfortable and feeling vulnerable. They go to turn on their TV, it's not just Judge Judy anymore on their TV. Now they have this smart device that is asking them for information. It's asking them to complete checklists. If nobody tells them what's going on, you're going to just have veterans on there clicking anything and all day and every day just to get it to go away so they can get back to their TV program. So you have to set those expectations up front upon admission. We do a pretty good job with our patient orientation module to where we can provide mandatory education that actually locks the television out, so the veteran has to complete that before they can watch TV. But that's just a supplement to the face-to-face contact with whoever is responsible for orienting that veteran to the room should be orienting them to the television as well to set those expectations. Including patient education as part of hourly rounding. This is key. Whenever your clinicians are doing their hourly rounding, incorporate patient education into that. Whenever a nursing assistant, I don't know why there's such hesitation with this when I talk about this, but nursing assistants they're the ones that are in with your patients the most throughout the patient's length of stay. Make this part of their routine. When they go in, before they leave the room, maybe they should start a video for the veteran. And then when the RN does their rounding, they can come in and do the teach back and the follow-up to what the veteran just watched. That's just one best practice that I've seen out there within our community. But leverage your nursing assistants because they're busy, yes, but they're really the ones that are in the most with the veterans, and they're the ones that can help drive your utilization numbers up. Develop a communication plan around keeping staff informed and engaged. We partner with a lot of VAs around putting information within your weekly newsletters that you already currently have within your facilities. we should be able to have a section within that newsletter to where we can promote new things that are coming with patient engagement, any new features or solutions that we might be turning on. Right now, our great new feature that just came out this week is around coronavirus. So we have a favorite tile now with information around coronavirus that has become very popular. Everybody wants it. So that would be, we need to be able to get that information out to the facilities and to the staff. Incorporating DAISY nominations received through the GetWellNetwork. This is a really good thing that I like to use when I train nursing staff, is because they always ask, what's in it for me? We're going to give your patients now the ability to nominate you for an award, for doing an outstanding job taking care of that veteran. And so that's something that they like to promote. And I will see RNs go into the room and actually guide veterans to where this thing is so that they can send a nomination up for them so they can get this award. And then including GetWellNetwork as part of your journey as a high reliability organization within the VA. Staffing, education, and training. So what is our goal behind this? We want to make sure that every staff member is comfortable using GetWellNetwork. That's the ultimate goal behind this. So you want to include GetWellNetwork into new hire orientation agenda. I understand, your NEO is probably packed full of, you're trying to get everything under the sun covered, all those joint commission requirements that every, employee has to go through before they can work in your facility. Like I said, part of your director's welcome speech, just 2 to 3 minutes, just a little plug about patient engagement, how important it is, and how they're using this as their digital health strategy, and they're using this as their strategy for performance improvement. Just have that plug in there is real critical during NEO. And then we can break out and do, the actual training with the nursing staff and any ancillary staff. Develop an ongoing plan for training with a blended learning approach, hands-on and online. This is where that, annual competencies is going to come into play. If you are contracted for a client service representative, this is really what they're going to be doing to support you all. They should be leading your sustainment and ongoing training plan, post go live for you. So it's not something you have to worry about. Let us take care of that for you. And then having a multidisciplinary patient engagement strategy to involve all services to educate and serve veterans. I can't stress that enough. This isn't just a nursing solution. This truly is a multidisciplinary solution that can touch every single service within your facility to help improve, the patient experience within your facility and get the quality outcomes that you expect to get from our software solution. All right, so any questions for me? Sure, we recommend 2 per unit per shift for super users. Okay, no problem. Paul.
So, Carl, from a kind of day-to-day contact perspective, where do you see that being assigned? Who's the right type of person to kind of, not at an executive level, but that day-to-day contact that we need to interact with? Who is that? Where's that best fit in the organization?
Right, so that's actually a great question. So when we bring new clients on board, we ask that those new clients identify us, an executive champion that's going to kind of be our champion that has executive oversight of patient engagement as your digital health strategy. And then we ask for you to identify a system manager. And that system manager is going to be our point of contact for daily operations. For the use and driving utilization and getting the outcomes with our software solution. Not only on that, whenever you launch any new piece of technology, when I start talking about the value plan again, each one of those focus areas that you identify on your value plan should have a champion assigned from the facility that's going to have oversight over that particular focus area. And I like to coach new facilities coming on board is it should be somebody in your facility that's already has a vested interest in that focus area. So if you're going to focus on falls as one of your priority outcome focus areas, your patient safety coordinator, your falls coordinator is already kind of has oversight over that. They should be your champion over that particular focus area. That kind of answer your question? Okay. Any other questions? Megan?
Well, it's not a question, but, I think it goes under, wouldn't it be cool if section for the government, if there was somewhere that there was like a library or what videos other government facilities have utilized, so then they already are if they're up on one system, they can easily be brought on to another system. Because this week, you've heard of a lot of different videos that people created or pulled off of VHA, and they're utilizing it with GetWell. I would love to know that instead of trying to recreate the wheel, or, it'd be easier for you guys, too.
There's one initiative that we're going to be starting this year, is a government chat community. So our pediatric community within our organization has a great chat community where all of our pediatric clients have one place that they can collaborate, share best practice, talk about video content and what's working for their facility. So we're going to mirror that, and we're going to create one for our government community, and that's going to be really that one resource where we can share. If there's content that VA New Jersey has made specifically, to prevent heart failure, for instance. This is an example. That content can be shared, throughout the rest of the VA because it's VA produced. So,
I just need to know where it is.
yeah.
So, Carl, along those lines,
Yes.
we did have Pulse, which is sort of like a Facebook page, and now it's being migrated over to SharePoint. So I'm wondering if we could just host something on SharePoint.
Yeah, we could do that, but we don't have access to your SharePoint, unfortunately. So we would need somebody from the VA to partner with us to maintain that
And
partnership with us.
we were in system manager training the other day, and I played around with that concept and actually was able to load our welcome video that as a draft to show the new system manager. So it can be done, and I'd be happy to help with that if I could.
Just so you guys all know, though, you need to get OIT access, a waiver for that SharePoint site for videos to live on there, because they have a bot scrubber that runs through and deletes them for you. So please make sure that you do that if you're going to do that, because it would be great to be able to see the videos, but we would need to get, they call it an exclusion. So we need to get an exclusion to be able to host videos on that SharePoint site.
Or even just a list, and then we can bug everyone via email, send me that video. But, we don't know who's doing other things.
Well, it depends on what level we want to get it hosted at. So if we worked through, say, Vane, for example, and we worked with their SharePoint site, they're in the process of moving their SharePoint site over, we could possibly work with the Vane group and have that Vane site become the host site for our site, and then have them get the exclusion at the national level. Then we'd be able to load them all in that site and work through that site.
I just wanted to comment. Thank you, Carl, for the presentation. And in terms of availability to content, I think using the GetWellNetwork community website probably is the short-term answer. And we'll make sure that that's a little easier accessible and point to that. And then, like Carl said, our plan this year is to start a community call, a regular call, similar to what we're doing on the pediatric side, just so that we have more kind of open discussion, not so formal as a webinar series, but really have client presentations. We'll present sometimes, and just to share practices and, kind of what are the pain points out in the community while you're using the system. So I think that will help solve some of the issues that I'm hearing.
Like, I have an awesome IPC manager. If I want something, I say, can look around and ask everybody to have a video. He goes and get it. So I do have a new video we just did for a PAVE program for a patient. So I'll share that one. I'm going to share it to our steering committee. Everybody knows what PAVE is? Pre-application. Oh, okay.
And just to tag on to what you just said, Lourdes, is that similar to how we just, Friday is when we started work on the coronavirus feature that was shown today in the session this morning by product. And so something like that, if you have something that comes up, either condition specific or there's an issue that you want to communicate widely, ask us. We'll put our heads together in terms of getting a solution put together, and then we can get that up and running on the system. And again, they mentioned, use your system as a communication platform. So for, any kind of like natural disasters too. So, there's other ways to look at the system beyond just health content education.
Another thing for accountability going on wouldn't it be cool if, is for accountability if some of the reports could be exported easier and in PDF. Christy's shaking her head because I always say it. But to share it with my nursing staff, it would be nice to do trends and pretty pictures instead of just exporting it into an Excel and then we have to do the pretty pictures. We don't have time for that. But so if we could, have those reports, that would help with the accountability on all levels.
So it's about a year away. I met with Mr. Brook today, and because you guys have heard this a lot about the reporting functions, and so they said they're got a 9-month build time, some testing, but it's about for some functionality. I know we're all want it, but for the functionality that is really useful for, especially for yes, it's coming.
I know Megan's probably sick of hearing it. But so I know there's a lot of heartache, over the past couple of months because we did have to turn off certain reporting features within the management console that a lot of you all were leveraging on a regular basis. Just know that, our development team is working hard to try to get better reporting mechanisms in place through the management console, but they had to find out where it's broke first before they can fix it. And so in order to do that, they have to turn certain things off in order so they can troubleshoot and see where was the breakdown? Why was one report reporting one thing and another one reporting another thing? But we're getting there, and like Brian said, unfortunately we're probably a year away from being able to get something back to you. But what I will say is leverage your client services team. I mean, that's why we're here. Let us know, and Megan, let us know. We will help you generate whatever report that you want to see for your site. Any other questions? All right, I guess we're going to get done a little early, and thank you all very much.